after interviewing many NHS patients that although we have come a long way, there are many improvements that still need to be made. As my gift to the NHS for their 70th anniversary this year, I want to share my top 5 solutions that could revolutionize our healthcare system. Number 1. Digital health seamlessly integrated into our existing system. We're living in the age of a digital revolution where everybody is on their phones using their health apps. We need a system that can seamlessly link the apps we are using with doctors and healthcare practitioners. Number 2, a national electronic health record. Currently, the NHS is a cluster of thousands of sites who all have their own electronic record, and some don't even have one. So, how much better would it be to have one healthcare record across the whole nation? So when you go see your doctor, before he even sees you, he will have all your previous history from wherever you were in the country right in front of him. This would get rid of the cost of duplicate exams and get patients an accurate diagnosis faster. Number 3, app-based ultrasound. As a sonographer, using latest medical technology is something I'm very passionate about. Ultrasound is the most commonly ordered imaging exam in the United Kingdom. But unfortunately right now, the wait to get an ultrasound can take weeks. Imagine going to the doctor for a belly pain. The doctor says you need an ultrasound, but hold on, here's an app, and using an app and a simple ultrasound device, your doctor can tell you right there and then what's going on with you without any wait. With a little bit of sonography training for medical students and doctors, we can easily make this a reality. Number 4, a digital booking system for faster appointments. How wonderful would it be if on a national level we had an integrated online booking system? Imagine having this booking app on your phone where you could scan your thumbprint as your ID, log into the digital system, look at your medical record, and then book your next appointment seamlessly. Number 5, a strong focus on prevention using holistic health education. This is something I always try to discuss with my patients. We have become a system that is too dependent on doctors and drugs. It is not unusual to go into the A&E and find patients who don't really need any urgent help. I speak to my patients every day about how they can take ownership of their own health. We need the doctors and medical practitioners in this country to educate the patients about their diet, nutrition, and lifestyle so we as a nation can feel empowered and understand how we can be more in control of our own health. Now, how would the British population feel if we as clinicians took the initiative to really implement these 5 solutions? Let's find out. Would you like to see more digital improvements in the healthcare system? So there's an app coming out for NHS where you'd be able to book your appointments now through that app. Do you like that idea?
Yes. And
there is an app coming out now for NHS where you'd be able to book your appointments right on your phone. Is that something you'd like to see?
Yes, yeah, I think so, yeah.
Would you like to see more digital health being introduced? So there, for example, there's an app coming out now with the NHS where you can book your appointments right on the app.
Yes.
Is that something you would be interested in, where you don't have to wait for long?
Yes, definitely.
You go see your doctor and let's say you need an ultrasound. What we're trying to do is they do your ultrasound right there and then. Is that something you think you'd like instead of waiting?
Yes, of course.
Yeah.
Yes, of course.
Yeah. What about more advice on prevention and diet and lifestyle?
Yes, and I think they have done that with the Couch to 5K, and so it's getting out there.
It's getting there, isn't
yes.
it? We'd just like to see more of that continuing.
Yeah, definitely.
Okay. Would you also like to see doctors giving you more information about prevention, diet and lifestyle?
I think that the focus in the NHS at the moment is far too much on when it's got bad.
Yeah.
And I think that there should be much more diagnosis and treatment earlier on, rather than waiting until you're actually in an emergency. That's generally speaking what happens.
Okay,
is that we don't deal with it until actually it's a bit of a crisis.
So what I have learned is that Britain wants our NHS system to progress very quickly, which is why it's imperative now more than ever that we focus on digital health and preventative education to make this happen. So by the time it's our 100th anniversary, we can say that we're the best healthcare system on this planet.